Hello and welcome to Healthcare Reform 101. What the health is going on? We picked this title. We knew it was a risk, but for us, we have been handling healthcare reform as it has been coming down the pike now for several years. And year over year, it presents new obstacles and challenges for us to work through and to overcome. And we find ourselves asking, what the health is going on all the time? So it's meant to be humorous. We hope that you took it with the spirit of which it was intended, just to bring some humor to a subject that's been very heavy over the last few years. So we are going to go ahead and get started and dive right in. The force of gravity pulls things down. The force of purpose pushes things forward. We found this quote very fitting. Here at Alkali, we truly care about the ACA changes that are impacting your family and your business. We're here to serve you. Our sole purpose as a broker in general is to serve our client. If you don't have a broker, or if you do have a broker, then he or she should be going out, collecting all of the research, presenting to you the net so that you have the ability to make a good choice based on the options that are available. And they should be able to advise you to help you kind of whittle it down to, well, what's my best choice? Sometimes right now our best choice is not our favorite choice, not one that we really like, but we at least find the peace and the comfort in knowing that we turned over all of the stones and we've made the best choice for what's out there. My name is Corey Nooner. I'm the Client Service Leader here at Alkali. And this is my email. So I know that in today's webinar, I'm not going to even attempt to potentially answer every single technical question or curiosity, but I want you to have the ability to start typing up an email to me as things may come up that you need more information on, you're curious about, even if you have a comment or a suggestion for me. I am completely open to it. I plan to host several of these webinars over the next few weeks in order to push information out to our clients and to other individuals about what's going on, give them some handles for open enrollment, and hopefully just give them some information while they may be waiting to speak to a broker. I know this week open enrollment has begun, and our consultants, Don and Tim, who are also listed on here, are very busy. We have them in scheduled appointments back to back, so our service team is handling a lot of calls for them and scheduling the appointments. In fact, if you're a client of ours, you've probably received a call from us, or you will be, to do a policy review, especially if you're with Blue Cross Blue Shield and your plan's being discontinued. So hang in there, be patient, whether it's us you're working with or another broker. It's going to be a fast and furious few weeks, especially this week, just as everything is new and the technology gremlins are in full effect. I'll show this slide again at the end of the webinar in case you find then that maybe you ended up having some questions after all. So let's look at what today's focus is, what we're going to attempt to cover. I am looking to buy health insurance under the Affordable Care Act, the ACA. What do I need to know? I have a grandfather plan. Can I find a better deal? My plan is being discontinued. Is the plan I'm being mapped to my best option? When is open enrollment for 2016? What do I do if the Affordable Care Act is simply not affordable for me? Should I leave my employer plan for the individual market? So this is our focus. We hope that you will get clear on some things that maybe you weren't clear on before, or you'll gain some insight that will be beneficial to you or maybe somebody you know. So first, we're going to do a general ACA overview. I want to make sure that we're all on the same page of what the Affordable Care Act is and isn't, and maybe debunk any myths that may be out there. So Obamacare is the nickname given to the healthcare reform law by the media and general public. So we commonly refer to healthcare reform as Obamacare or the ACA. Really, it's all of this healthcare reform that has been legislated and has been rolling out over the past several years. So there's no special Obamacare plans. And today, as we work through this, I hope to really make it clear on how the legislation works and what it means for you as to what's available and what's not available. The Affordable Care Act, aka Obamacare, affects the way we all buy health insurance. All individual health insurance plans were affected in some way by the Affordable Care Act. There are not special Obamacare plans per se. The ACA adds a tax penalty for anyone who doesn't purchase a qualified health insurance plan. There are some exemptions that we'll discuss a little bit later that would make it where you could sidestep the penalty and not have health insurance if you qualify for an exemption. Affordable Care Act penalties. If you didn't have coverage in 2015, you will pay one of two amounts: 2% of your yearly household income, or $325 per person, $162.50 for a child under 18. Maximum for a family is $975. If you don't have coverage in 2016, you'll pay the higher of these two amounts: 2.5% of your yearly household income, or $695 per person, $348 per child under 18. Maximum for a family is $2,085. So you may be looking at those amounts, and then you may be looking at what your premium is or what it will be for 2016 and thinking, penalties are a lot less than what I have to pay for my coverage now. And while that may be true, doesn't necessarily mean you should ex-nay the coverage and go with the penalty. We'll talk about a few things a little bit later in the webinar to help you weigh out what you really want to do. Premium of the Affordable Care Act plans have increased significantly over the premium of pre-ACA plans. It's seemingly not sustainable at this point. Our pocketbooks are staying close to the same, yet our premiums are jumping year over year at a very astronomical rate. The government currently allows a subsidy to help lower the cost of health insurance for qualified individuals. Your income and number of applicants determines if and how much of a subsidy you'll receive. You're not required to take a subsidy even if you qualify for one. So one of the things that some people ask is, if I qualify, do I have to take it? And the answer is no. And the reason for asking that is because they typically just don't want to have to go on the healthcare exchange, which we'll talk about in a minute. So let's look at the differences between on exchange, which is also known as the marketplace, and off exchange, which is also known as private. So there's a lot of confusion surrounding this and what it is and what it isn't, what are the pros and what are the cons. So let's take a look. Before we go into the bullet points, one thing I want you to know is that most of the plans that are available from the carriers are available both on exchange and off exchange. Now, there are some plans that are only available on exchange, and there are some that are only available off exchange. But for the most part, most of the plans you can get either way. So it's just a different way of enrolling, because when you go on exchange, we have to enroll you through healthcare.gov. When you go off exchange, we still just enroll you directly with the carrier. So it's just a different way of applying for the plan that you ultimately pick. So on exchange is the only place to receive a premium tax credit or a cost-sharing reduction. So if you qualify for a subsidy, then you have to enroll on exchange if you want to utilize that money. So for example, the premium is $800, you qualify for a subsidy of $400, you'd have to enroll on exchange, then your premium would be reduced to $400. You can purchase through an agent or broker as long as he or she is certified through the FFM. That's the Federally Facilitated Marketplace. All of our consultants are certified for the FFM, and we get recertified every year. all policy service must be handled by healthcare.gov. So if you choose to enroll in a plan that you have to go on exchange to do that with, then any service needs you have during the year, say you have, you've moved and you need to change your address, you have a billing question that you need help with, you need to add a dependent or drop a dependent, it has to be done through healthcare.gov. It can't be done through your agent or broker, and it can't be done through the insurance carrier. So what we're finding is the service is not super stellar. The wait time can be longer. The calls can seem and feel very scripted. You can call once and get a certain answer, then call back and get a different answer. So it can be very frustrating to have to go through healthcare.gov in order to get your policy services. And so they're also known as navigators. They've hired a bunch of navigators under a third party to help with all of this service. The HHS reserves the right to review your IRS records annually to redetermine subsidy eligibility. And it can also force you to put your kids on CHIP. So sometimes what happens is we estimate a client will receive X amount of subsidy. We take them through, we kind of have a backdoor process of going through healthcare.gov to enroll our client through every step of healthcare.gov. But at the end, instead of getting the finalization of what the subsidy will be, it'll say you need to contact this agency to see about putting your kids on CHIP, because they want you to go that route first. And then if your kids qualify for CHIP, it may leave you, and or if you have a spouse, not qualifying for a subsidy anymore. And then you would just have to pay the regular cost for yourself and or your spouse. So there's just different hurdles that can happen along the way when you go on exchange that we can't foresee always at the beginning, just because of the nature of who determines the rules and what information they may ask along the way can kind of change the course and not make the process as smooth as we would like. And then the second thing is the service, and the third is really having to watch your mail. If you're getting letters from the IRS, you really have to act on those right away, because what we find can happen is someone will get a letter where they've decided they want additional information. And if that doesn't get fulfilled, they'll cancel the subsidy, and now your cost has gone from $400 to $800, which may not be affordable, and it can be almost impossible to get reinstated at that point. And then you have to be able to make your payments all the way back to whenever the cost initially went up, and then a lot of times the government's not going to pick that subsidy back up until months later, leaving you with having to make that full payment. So there are definitely hurdles there that you have to just be a little bit more cautious and a little bit more on top of to make sure that something like that doesn't happen to your policy. Let's look at off exchange. So off exchange you can purchase also through an agent or broker or insurance company directly. There's no cost difference when you use an agent or broker for your individual insurance or if you go directly through the company. The gains by using an agent or broker are, again, carrier neutrality, somebody advocating for you, not the insurance company, and finding the right broker. Here we have the heart of a teacher. We really want to help people have the right options and the right insurance for themselves. We do not pay our agents or brokers based off of premium, because we believe that would be a disadvantage to our clients, and so we want to make sure that everyone's freed up to present the right plans, and then our clients can also feel good about the service that they're getting, and it's not contingent upon their brokers trying to place them with a certain policy or carrier because they're going to win a trip. Well, we don't operate that way at all, because that's just, not only do we feel unethical, but we want to feel like we're doing the best and the right thing every day. Secondly, going off exchange, your policy service can be handled by a broker or agent or with the insurance company directly. You don't have to go through healthcare.gov for anything that you need during the year. Finally, no additional government involvement. I underline that because obviously government is already quite involved in what's going on with our healthcare. Going off exchange, there's no additional involvement at that point. So those are the differences between on and off exchange. Maybe the myth about the special Obamacare plans may just be on exchange being the place where you have to go to utilize that subsidy, but hopefully this has cleared up any confusion that may have been there for you. So we keep talking about qualified ACA. You have to have a qualified health insurance plan. So a qualified one is a plan of metallic level. Oftentimes the name will have bronze, silver, gold, or platinum in it. It's issued by an insurance company on a guaranteed basis. This means you won't complete a long form detailing your medical history. The premium is based on age, zip code, and tobacco use. This health insurance plan must also cover the defined minimum essential benefits listed below. So with the legislation, all individual plans had to cover these services and or improve these services. One of them would be maternity and newborn care. That was not typically something that was covered under individual plans and now is. They've also increased the mental health and substance use disorder, as well as prescription drugs, including behavioral health treatment. One of the biggest ones that affects everyone is preventative care. All those wellness services that are now covered prior to meeting any deductible, and you don't even have to pay a copay if you're on an ACA plan for those services. And additionally, pediatric services. Most people, if you have children under the age of 18, you've probably had to pay additional costs to have pediatric dental, which most of us will not use. It's more or less a tax. It's a service that is really more for birth disorders or defects such as like cleft palate, things like that that are more uncommon than not, but yet they have to be covered. And then if you have children under 18, it means you have to pay more for it. Hardship exemptions. These are available through healthcare.gov. Excuse me. There's too many to list, but there is a long list of reasons that could allow someone to go without coverage for part of the year or all of the year, depending on your personal circumstances, that you would not get a penalty for not having health insurance. However, if the lowest qualified health insurance plan costs more than 8% of your modified adjusted gross income, you could be exempt from purchasing a health insurance plan and paying the tax penalty. Then at that point is when they say it's unaffordable. They meaning the government. Why are premiums so high? Everyone says, why is this called the Affordable Care Act? It's not affordable. This is way more expensive than what I was paying before the Affordable Care Act came. So since January 1st, 2014, carriers have had to approve all applications for individual health insurance. No medical underwriting has been required on the ACA plans. So for the last 2-3 years now, we've seen the rates just go sky high. The actuaries set it high out the gate, but now that they actually have real claims data, it's worse than they thought, being that they were not able to take a look at health for any individuals to either exclude or decline, so they've had to reset their premiums. And even worse, this year in the state of Texas, Blue Cross Blue Shield found that the PPO plans are not sustainable at an affordable price due to anti-selection. So Blue Cross Blue Shield is doing away with their PPO plans on the individual market altogether and moving to HMO because they found that they cannot continue to offer an affordable plan on the PPO platform. And again, all going back to, that they're having to cover everyone, and not everyone is getting insurance. So there is an issue with anti-selection and them having to cover claims for those that are more sickly or have other issues causing higher claims, and then some of the healthier, younger people have not yet enrolled in the plan to help balance that out a little bit more. But at this point, I'm not sure that any of that is going to be able to be balanced out at this point without changes being made. So what is happening to the individual networks? Let's take a look. across the top here, you'll see 4 of the major types of networks: HMO, a health maintenance organization; POS, wait for it, it's called Point of Service Plan; EPO, Exclusive Provider Organization; and PPO, Preferred Provider Organization, that we're all used to. Most of the carriers are moving to HMO and EPO only. There will be a couple of PPO options available in 2016, and really not too many POS ones. Some of the carriers tried to have those this last year, but they're mostly moving to EPO. So let's look across the top. It requires a PCP. A PCP is your primary care physician. So an HMO plan, typically, yes, they require that you have a primary care physician, so they could be like the gatekeeper for you to have to go see before you can go see a specialist. An EPO and a PPO do not require you to have a PCP. HMO, yes, requires referrals. EPO, PPO, no. Pre-authorization under an HMO, usually it's not required. The PCP does it. But EPO and PPO, yes, you need to get pre-authorization, especially like for your hospital stays, surgeries, things like that. In red, this part is really big, and this is really where this thing has turned on, on its head this year, is that HMOs and EPOs do not pay for out-of-network care. So for a lot of our clients, we have many people who travel, and this presents a problem for them. A lot of people don't want to give up their doctors or a certain hospital, and 2016 is going to make this much more challenging to do, because now you're not going to be able to say, well, here's all my list, I want to make sure they're all covered, because there's a good chance that that is not going to happen in the individual market anymore. So that out-of-network is a big deal, where this year, more than ever, telehealth services are going to be really important. Our consultants are presenting that to certain people who really need to find an additional solution or a supplement, because if you go out of town and everything's out of network, if you can call telehealth and maybe get what you need, a lot of times we end up going to like urgent care for usually the same stuff, right? Flu, sinusitis, bronchitis, urinary tract infections are actually in the top 5 of reasons why people go to urgent care, and a lot of these things really can be assessed and prescribed through telehealth. So that's something to consider with these networks being more limited. Cost sharing, typically low with HMOs and EPOs, high for PPOs. And then, of course, do you have to file claim paperwork? No on HMOs and PPOs, or EPOs. PPOs only for out-of-network claims. So that's just kind of the overview of what's happening to the networks. So let's take a look at the main players in the individual market for 2016. So over here on the left, we've got Aetna, All Savers, all the way down to United Healthcare, and kind of where they're going to fall in these networks. Aetna is going to have an EPO, and they will be both on and off exchange. So they're going to have plans both on and off exchange. All Savers, I'm not positive what their network is just yet. They're actually owned by United Healthcare. They may end up operating under United Healthcare for the first year just because of the credibility. I believe they're going to have an EPO, but they're only going to be on exchange, these All Savers plans. Whereas if you skip down to United Healthcare, they're only going to be off exchange. So that will be interesting to see kind of what those look like. Blue Cross Blue Shield, only going to have HMOs going forward. They will be both on and off exchange. Cigna, EPO, both on and off. Humana. So yes, Humana was bought by Aetna. However, they are going to operate under Humana for 2016. They're offering a PPO plan. It says on here that it's both on and off exchange, but I heard this morning that it's only going to be off exchange. It will be a PPO plan. Again, the network will be much more limited than the Blue Cross Blue Shield PPO. It's going to be smaller, but it will be a true PPO. Oscar is a new carrier. They were only in New Jersey, and now they are coming to Texas as their second state. They're going to have an EPO both on and off exchange. Scott and White, you may have heard of them as Baylor Scott and White. They are coming in the market. Well, they've been in the market. We feel like this year will be their most competitive year yet, especially since Blue Cross's PPO is going away. Scott and White has their own HMO and their own PPO network. Of course, that means Baylor hospitals for that network. They're going to be both on and off exchange. And then, of course, United Healthcare, as we discussed, EPO off exchange. So that's the overview of who are the main players, the A-rated ones. Yes, there are more than this, but these are the more popular ones that have the most plans and flexibility. Grandfathered, is it a better deal? Anyone that purchased a health insurance plan before March 23rd of 2010 and has not made significant changes to their plan is considered grandfathered. Well, what does grandfathered mean? You are protected from the Affordable Care Act and are not required to purchase a new plan next year. As it stands right now, grandfathered plans will be able to stick around until 2018. Not sure if that's going to be extended or not, but right now they're running well. All these plans were medically underwritten. They're still on the larger PPO networks. They're renewing at sustainable rates. The rates are not increasing like the ACA rates are. So typically, this is a good place to be for the most part. We do policy reviews often, and typically it makes sense to stay grandfathered. However, in this case, the carrier can still look at past medical history to exclude coverage and increase premium based on usage. So when they get their renewals, they'll get their increase based on usage and potentially on their birth date as well. That can happen. The other issue with this is if you need to add a dependent, they have to be medically underwritten, and they could be declined or have an exclusion, which could potentially be problematic. In some cases, we end up having to write a dependent on an ACA plan if we cannot get them approved on a grandfathered plan. In very rare cases, does it make sense for someone to cancel their grandfathered plan? It's just we look at it case by case, and we make sure we do the math on it to determine if it's really time that you have to move to an ACA plan or not. So every year at open enrollment, if you have a grandfathered plan, evaluate it against an ACA if you happen to have any services that are excluded, or if for some reason your rate has increased due to high usage. You know, maybe you've had something, a health change in the past years, which sometimes can hurt you on the grandfathered plans but help you on the ACA plans. Pre-ACA plan. So anyone that purchased a health insurance plan between March 24th, 2010 and December 31st, 2013 is likely on a pre-ACA plan, otherwise known as a reform or transitional plan. So these are in between grandfathered. They're not quite ACA yet. So you're not protected from the Affordable Care Act, and your plan can be canceled anytime. Most of the carriers are allowing members to keep this plan through 2016. Some of them have already told us they're probably going to allow it through 2017, but again, there's no guarantee at this point because you know, they're not protected until 2018 like the grandfathered plans are. But for the most part, these are running better than ACA, which is why people haven't made the switch yet if their health insurer has allowed them to stay on it. Oftentimes it makes sense. Again, the carrier can still look at past medical history to exclude coverage, and they increase premium based on your usage of it. At open enrollment, evaluate against Affordable Care Act plan if you have any services excluded or your rate is increasing due to high usage. Okay, first timer. We have many people who are turning 26 and they're aging off their parents' plan, and so it's their first time to have to go and look for a policy on their own if they can't get it through an employer. We also have people who may be going through a divorce and they're having to purchase insurance for the first time during this ACA period, or maybe someone's losing coverage through their employer. Whatever your situation, buying health insurance can be scary, especially now with the changes in the marketplace due to the Affordable Care Act, but there's hope. To find the best plan for your needs, ask this. Is a low deductible or lower premium important to me? How do I use my current plan most? Labs, x-ray, prescription, office visits, etc. Again, a lot of changes are being made where maybe labs and x-rays aren't going to be covered under your copay anymore. So there's always something to consider when your plan's coming up for renewal. Can I work with a limited network of doctors and hospitals? Am I open to buying on the exchange to save money? These questions will help narrow the field to give you an idea of the plans to best fit your needs. Purchased and confused. You recently found out your plan is being discontinued and you are being mapped to a new plan or network. Many plans are making changes to its provider network, copays, coinsurance, and drug coverage. Your plan must send you a notice of any changes it will make for 2016. Read your notice and see what it means for you. Can't stress any more than we have been. Please make sure that you're checking your mail and you're really opening up those letters that are coming from your insurance carrier, because in some cases it's really drastic changes or your plan's being canceled, and you really want to make sure that you're getting an appointment or a call time scheduled with a broker if you use one, to make sure that you're going to get some help with what your options are if you have to make a switch. Check to see if your network is still what you want. Your doctor or the hospital you prefer to use may no longer be in it. In some cases, you can use out-of-network doctors and hospitals if you're willing to pay more. In some cases, you might not be covered at all if you go out-of-network. Your prescription drug coverage could also change. The plan may no longer cover the drugs you take to manage your chronic conditions. It's important that you check your plan's drug benefits for 2016 before you allow it to renew. Health plans must provide an online link to the list of drugs they will cover. These are known as formularies. Typically, health plans renew automatically. However, keep in mind premiums for all ACA plans, those increase on January 1st. So anyone who's on an ACA plan, even if they just purchased it, if they had a qualifying event and purchased it October 1st, they still get an increase January 1st, because that's when all of the plans renew and get their big increase now under the Affordable Care Act. So check those letters. If you received a notice from the IRS reminding you to file Form 8962, make sure you filed this with your 2014 taxes in order for your subsidy to renew for 2016. It's recommended that you resubmit your subsidy application to take into account any changes that may have occurred in 2015, but it's not required. If your subsidy stays the same because you didn't resubmit your application and the premium of your health plans increases, obviously you'll pay more per month. So you have to just be prepared for that when your bill changes. So open enrollment is the only time you can change your plan. Plans can be canceled at any time. If you miss open enrollment, you may have to wait a year to sign up. Plans can be purchased only during the open enrollment period or 60 days following a life-changing event. So a life-changing event could be marriage, divorce. If you lose coverage, maybe your employer ends up having to drop the plan, or wherever you have coverage, it gets lost. You get a notification that it's going away, or you're losing it, or you're no longer qualified. You can get insurance outside of open enrollment under those types of events. But you have to do it quickly. It has to be done within 60 days of that life-changing event, and really before it cancels. Otherwise, you could end up having a gap in coverage, which could be problematic for several different reasons. Healthcare purchases continue to be complex, and customers continue to look for guidance from professionals. Enroll America found that consumers who utilized in-person assistance were twice as likely to enroll as someone who only went online. So when is open enrollment? It's now. It began this week. November 1st, and it will end January 31st. But your coverage does not start immediately. If you sign up between November 1st and December 15th, your coverage will start January 1st. If you sign up between December 16th and January 15th, your coverage will start February 1st. If you sign up between January 16th and January 31st, your coverage will start March 1st. So just make sure that you're aware of the dates and the deadlines for when you want your insurance to start. But no one's insurance can start until January 1st unless you have one of those qualifying events that we discussed on the last slide. So what if the ACA is not affordable? The increases year over year, oftentimes with reduced coverage, are not palatable and may not be affordable. If you've exhausted all of your options and you come to a crossroad, consider the following. What will the penalty for not having qualified insurance in 2016 look like for me? Compare that to the lowest cost ACA premium for 12 months, which is lower. Of course, if you can get coverage, that's going to be your best bet because you have something to protect you, but then you're also not paying the penalty. But you just have to do the math exercise on it. We never recommend that anyone go uninsured. Protect your assets by putting a short-term medical plan in place. While these are not qualified, ACA qualified, they do provide coverage in the event of a major medical event. The only catch is there are 5 to 7 health underwriting questions that you must pass in order to get approved for the short-term medical plan. But if you're able to get approved for them, they are inexpensive. They run on the big PPO networks, and so it's a good safety net to put in place if one of the ACA plans is just not affordable. But again, you would not be able to sidestep the penalty by taking one of those short-term medical plans. And you can take those short-term medical plans for up to 12 months. So then what would happen is when you came up for open enrollment again, you could then look to move to an ACA plan. Time to leave your employer plan. The Affordable Care Act had an effect on small businesses. Therefore, your take-home pay may decrease due to an increase in your medical premium. So what you want to ask yourself is, does the open enrollment of your company happen between November 1st and January 31st? Or have they modified their Section 125 pre-tax plan? That just means that Section 125 pre-tax plan is just the document that your employer pays for in order to pre-tax your benefits from your paycheck. So a lot of employers are making amendments to these to allow their employees to be able to drop during the open enrollment period to take an individual health policy if they need to. Now the catch to that is you'd have to enroll on the exchange. Even if your employer made that modification, you have to take an exchange plan. Isn't that convenient? It's all kind of tied together with the IRS there. But if your employer's open enrollment matches up with this, then obviously you could choose to drop your employer plan and go the individual route. However, typically we find that that usually is not cost effective for employee-only costs. Typically your employee-only cost is affordable with your employer, but it may be your dependents that is not affordable, and so you can place your dependents in an individual policy at that point. Now say your employer's plan enrolls outside of individual open enrollment. Maybe your employer's open enrollment is in April or May or August or September or somewhere in between there. At that time, your dependents can drop from your employer coverage, and it creates a qualifying event where they can go ahead and enroll in an individual plan during that time. So that's always an option to look at if you need to look at cost reduction due to whatever that increase may be at that time. So, yeah, basically I said these before I put them up here. So if so, you can opt out of your employer plan and choose an individual plan that may be a better fit for your needs and budget. If not, you may be locked out, where you can maybe consider talking to your employer or HR about modifying their Section 125 pre-tax plan. Parting thoughts. Keep calm and shine on. Whatever you do, don't panic, don't procrastinate, don't buy a health plan based on metallic price and metallic tier only. Don't do something just because someone tells you to. This includes us as well. And don't go without help if you need it. It won't cost you more, but going without someone helping you through this process could be very costly to you. We are here to help. If you have any questions, please feel free to contact me. Here's my email again. We're happy to answer any questions that you may have. And again, I'm open to comments or suggestions for my 2.0 version to make sure that we're pushing out information that is helpful and useful to everyone who's out there. Thank you for attending, and we look forward to hearing from you soon.